Healthcare for All, next on International Focus.
The Institute of World Affairs at UWM and Milwaukee Public Television present International Focus, a global magazine linking Wisconsin and the world.
Welcome to International Focus. I'm Doug Savage, Assistant Director of the Institute of World Affairs at UWM. As people in the U.S. begin to sort out the on-the-ground implications of the recently passed healthcare legislation, for much of the world, access to basic health care remains a major challenge. The World Health Organization estimates that worldwide, 10 million children under the age of 5 die each year. To put that figure in perspective, in the time it takes you to watch this program, over 500 children will die, and that grim pace continues round the clock every day. Most of the victims could be saved with access to simple and affordable interventions. But in many low-income countries, people must pay most health care costs directly to providers out of their own pockets. Many discontinue a needed treatment or forego it altogether. Others must divert limited funds from basic needs like food, shelter, or their children's education. To help us explore the barriers to truly universal health care and some alternative models to help achieve that goal, we're joined by a medical doctor on the front lines in the fight to bring health services to all. Dr. Luther Castillo directs the For the Health of Our People Foundation in Garifuna, Honduras, which works to bring vital healthcare services to the country's underserved indigenous coastal communities. After graduating from medical school, he returned to the Honduran coast to establish the region's first rural hospital. In 2006, Rotary International in Honduras named him Doctor of the Year. Dr. Castillo joins us after recently helping to supervise Haiti's largest international health mission, with over 770 doctors from over 20 countries. Dr. Luther Castillo, welcome to International Focus.
Thank you. Thank you for this wonderful opportunity of being here to share with you.
Well, I wonder if you could start us out with just sort of a sense of the state of global health care. Who has access, who doesn't?
In our country, the experience that we face now, more than 80% of the population don't have access to the health care. And the privatization of the system is every day getting more high. And the depression of the public system is facing a lot of problems what we have in our community. Then we are looking for the strategy. How can, with these new ideas, providing free health care in our community, it can be a way of a model of third world country that we are working in.
So, is there a concept of what health is? I mean, what are sort of the targeted outcomes you're looking for? What is a healthy person, and does it vary from place to place around the world?
There is some concept in medicine that has been developing to define a very healthy person who has some different other contradiction, and talk about in Spanish we call bienestar físico y mental of the society. But when we approach these issues, we are talking in this how we can learn to see the human being not only in the biological way, the integral way of biopsychosocial way, because it's not only the anatomy, it's not only the muscles and bones. The human being is how to think, but is a product of the society where he develop and grow. And in this social way, we have to see the issues of the cultural spirituality and the way how the beliefs of the people from those regions. And we are trying to apply this concept of medicine, of health, and the program that we are trying to develop in this area in this moment. And
do you think there has typically been sort of a top-down, one-size-fits-all approach to medicine? I mean, I'm thinking, for example, in this country, the practice of medicine is very technologically based. I mean, the larger and more expensive the machine, must be the better care you're getting.
Then for us, we don't have the access to those maybe high level of technique in medicine, and we have to develop and our skills to work with limited of resources, who help you a lot to work with clinical diagnosis, and to help you a lot to in this new focus to do very high preventive medicine. And we use the limit of resources that we have for technique to diagnosis, just to prove what we diagnose by the clinic, what the symptoms, by the interview, what the relationship, what doctor has with the patient. But the other side, it's by his psychological history, that we have to recognize where the environment where the patient is, what is the psychological problem that the patient has, to get a better diagnosis. This integration of all those issues, knowing the culture and the environment where our patient live, which is very important to get to a better diagnosis, but which is very important to get to a better treatment too in this person.
Well, we mentioned in the introduction your role in establishing the first hospital in your region in Honduras. Tell us a little bit about what it looks like back home and the experience of founding that hospital.
Then we face a lot of challenge, because when you reach to a community who have been very discriminated and very isolated, and people don't believe in nothing, and because every 4 years the politician reach to the area telling lies, and people don't believe, and we had to start with new strategies of letting the people know that we were coming with new ideas, and looking for the people help to help us to build the facility, because we came with this idea without money to the community. We were recently coming out from the medical school and wanted to work with people. Then we designed idea to go community by community, speaking with the people, talking with the people, and convincing the people what was our ideas, and talking to the people how they can be involved in the process of this project. And we build a tent. People donate a piece of land. We clean it with the community, and we build a tent there. And we attended that tent for 8 months. We look for medicine, for donations, and we were attending there for 8 months. Thousands of people were arriving, and we were talking with them what they be the role in the process of building the facility. Then we get the opportunity to get the $5,000 first. Then we start to dig with the community and make the foundation, take some rebar, cement, and continue working, doctors and the community in this process, who was very important process for us, because the community participation in the process give more value to the project. But the other thing, we develop a new concept where people can take care of social properties, because that's the property of the community. Then we opened 2007, and providing with our doctors donating the voluntary work there. Then the doctors who were coming, who were Honduran, who were training at Latin American School of Medicine, we signed an agreement that they can return back to the community to do the residency of family medicine, in contact with the pathology of the community, in contact with the reality of our community, but developing a real program, a real new model of healthcare for those people, free healthcare for those people in those underserved area in Honduras. It was a wonderful experience. Now we have a small delivery room. We have a small external room. We have 15 beds for patients. Postpartum room, a small room for lab, ultrasound, dentistry. We're working hard in this process to develop this strategy of preventive healthcare, using the culture of the people, using the value, even using the music, the song, the poem, the art, the drums to promote healthcare in the community. That's the way that we face. And sometimes it's doing the job which is a little bit contradictory with what we learn at the university and the traditional way how to do it. We faces a lot of problem of anemia because of the parasite, and parasite because of the quality of water. Then we are developing a system how to work in that. And we face a problem of back pain and cervical pain in women and children and men who are working carrying hundreds of pounds of wood in their back every day to cook their food. But if you see this, I always talk about that, if you see this in a biological way, you will give for back pain, and we call sacrolumbalgia anti-inflammatory, who is more accessible in our country, is ibuprofen 500 milligrams. But how can you give for people who don't eat 3 times a day, who don't eat well, ibuprofen? You're going to cause another kind of disease like gastritis and others. But how can you send a woman to rest for 15 days, like as what books say, with 8 children to feed them? Then we face some contradictory with the traditional way how we approach. Then we develop now a program of providing and creating in the community that people can make the solar cookers with board and aluminum foil, and people can, be cooking their food and working in a program how the people can be accustomed to use it and work in this integral program, and people can rest a little bit or cooking wood, and they can save the environment. We can save children from respiratory disease because of the smoke. We can work in the anemia and boil the water, get the quality of water for or free of some of the parasites and different other agents, and they can be an integral program. Is a good example of having an integral vision of medicine and having an integral diagnosis, but as for, of course, having an integral treatment, you solve different problems.
Well, and there were no comparable facilities in the area before yours was established, right? I mean, how is it that the area was so underserved?
Yeah, the area is so underserved, and it has been a very isolated area without electricity, and it's difficult to run a health facility without electricity. Now we have been, the lack of resources have been sent us to develop a system with clean energy with solar panel. Then all our equipment is working full time with solar panel. Then we have to economize some of our energy. We didn't had opportunity to install some of our equipment because we don't have too much power to do it with solar panel. But this is the only facility who is in the area who for the people is a hope, because it's the first time they have free access to the healthcare, and they have opportunity to do lab, ultrasound. We can save many of life of women during pregnancy, of children and other people. But for the system, for the private area, become something dangerous, because when we say until 2007 to now, we have been attending 378,000 people for free. And when they listen to that, they multiplied for the money that we have been taking from the packet, because they saw those people from the area as a potential client. But we saw them as our patient. This is a different concept to approach medicine. Then we have to face with the system all this contradiction and fight against it. Even during the coup attack, we opened before 11 a small clinic in the community, and doctor living there. They closed all those for us, and during the coup attack. Then they closed out the agreement that we signed with the government of President Zelaya. That was some. They take advantage of the coup attack. Then we have some fight with the medical association, even with some workers of Ministry of Health, because we are demonstrating that there is another way to approach healthcare. We can do a lot with a lot limited resources, but we are still fighting there, struggling there to accomplish the way how can we give to the poorest of the poor access to the healthcare.
And we've got just about a minute left. Could you tell us what the healthcare system in the rest of Honduras looks like? I mean, we've seen a little bit of the model that you're putting in place.
Yeah, and in Honduras you can find some government facility and some even remote region, but without build it with some international organization who build without access sometimes to the community. Somebody who donate a piece of land who is a little bit far from the facility of community, but who has common problem without medicine. Without doctor, without human resources. Doctors in general don't want to go to the more far area to work, and without a human resources to work as a nurse. Sometimes you can find auxiliary nurse in this area. And in the process, what he had been doing, deteriorating the public system to reinforce the private system, because there's the same doctor who work in the public system and get paid, they build their own clinics, and the same doctor who treat you bad in the public system is the same doctor who will smile at you in the private clinic. That's the same thing. So because of the job with the government is well paid. But if you don't go to work, if you go to work, they pay you. You don't lose in the private system. Then you can go to the public system, make a big line. When you reach there, then the same doctor can tell you, I need to make you a lab test. I need to do this exam, but we don't have resources there. You know that the government is not giving nothing. But if you want, and you are in dangerous situation, but if you want, this is my business card. You can go to my clinic, my private clinic. Is and we don't think that that's function in the developing country like ours, where 80% of the people are living under poverty. They don't have access to pay $50 for an ultrasound. Then woman just say, God, do whatever you want to happen, and we don't think that this is a voluntary of God. We think that with this new vision, we are willing to let them understand that there is another way, that from the traditional way to do medicine in underserved area.
Great. Well, I'm going to stop you right there. We're going to take a short break. To our viewers, we'll be right back with more International Focus.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back. We're talking with Dr. Luther Castillo about global access to health care. Well, what about the role of sort of the development community? I mean, what is the model typically that external donors, for example, apply to trying to improve access?
And we face some issues in this external donation, because most of the money, Honduras is one of the countries who get money from external donation to program to prevent HIV, to program to develop different other work and how to prevent disease. But there is, we identify a problem how they address this money to the community. Sometimes they didn't even reach the community. Sometimes they stay in a capital just to pay the buildings, what they rent there, and the huge, big amount of human resources that they have in the capital. They just go to the community with high level to pay the trips to the communities and do some paper in the community and return back to the city. We don't think that that's the way to approach these issues. Like we have different program of HIV in the country, that the people think that solve the problem by making this big workshop in the most fancy hotels in the city and invite one member of the community to come to sleep for 5 days in a good room at the hotels and think that they can prevent the HIV with that strategy. Then disappear millions and millions of strategies in healthcare. We think that they have to, we have been talking about how to develop a strategy who come from the community, who come from the professional who work directly to the community, who understand the values of the community, who understand the philosophy of the community. And the program have to come from the bottom, from the community, who people who share, who recognize the values of people, and people can give their point of view about the program, even to do a consulting in a community. How can you apply a form of consulting who you take from developing country to underdeveloping country? Even the simple question is not the same, because you won't get the answer. People have their own culture, people have their own way even to be answered. You have to ask people how you want me to ask you if I need this kind of question, who is different. Even the consultant is not functioning using all those programming that is applying. We think that they have to readdress the form, how can use this money. I think this country, people from this country with this solidarity can help us to address that. They can help us to push this international organization to make sure that the money go to these people who are working directly in the community where the people want to get.
And of course it's easy for a large donor organization to go to the Ministry of Health in the capital, and they know how to do that. Mm-hmm. How do you connect the people with the money to that sort of grassroots, community-based
I think there are different organizations to work in healthcare, different efforts like ours. And the other thing is I think they have to introduce real people and their staff. who understand about this working in the community, but real people from the community, because we have professionals from the community too that they can join the staff and give some advice about this process. How the politics is running in our country with all the corruptions in the process, and we recognize the role of the minister of the work that Minister of Health have to do in this process. But we have been struggling for real healthcare, and we are against some of the strategy that they use, and we will continue it. And even that make us dangerous for the process of the system. And then our struggle is to continue providing the healthcare.
And traditionally, how much input has the community had in designing not an individual facility, but the healthcare system as a whole?
Yeah, who is like a utopia to do it, and the community doesn't have access to money. That's why it's difficult for us to charge people. Then we have been struggling with a group of doctors who are leading this process, even to let the government understand that that's the way to do it, and the government have to sign even agreement with the organizations that government have to provide the payment for the doctor, government have to provide the medicine for doctor, because we already built the facility, built the equipment, and start to work for them, because healthcare is a human right. People have right to the healthcare. They need, when they're born, then they have to understand that. But now we are doing an educational program there. People understand that, because for years and years they didn't teach people they have right to the healthcare, and people are willing to defend their access to the healthcare, and they have to pressure the government. The government have to pay the doctor, have to provide the medicine, and we can continue doing this job in this process. But this face another problem too, because if we work in this in this view, people will see the difference of many other doctors who are willing to work in the community, who are willing to be there with the people, who are willing to work not only in the area of medicine or giving a consulting to people, because some of the doctors who think that that is their only job, working in a clinic in the community, there's not the way to approach it in those underdeveloping area. You have to work in the people in the process of rural development and real project to rural development. Then our struggle is that we can reason some level that they can understand somewhere, sometime that they will be, that is the way to approach medicine in those areas, and they can provide the support to those projects, and we can continue serving more people and working in the preventive healthcare, who become to our country more or less expensive than fighting against mosquito and the dengue epidemics, or fighting against the mosquito and the malaria epidemic, who become more expensive for us, and we don't have even facilities in the hospital to take care of all those people who get sick in those epidemics. And we confront that using even the richest culture that we have to promote healthcare in our area. That I think that is a huge experience, and wonderful experience can become a model for the developing country.
But how dependent is the model on doctors who are inspired and passionate about providing that care? I mean, is it a system where it can be, for the doctor who's perhaps a bit more self-interested, is it sustainable?
Yeah, it's difficult to think that doctor can be doing voluntary work all life. They have to feed their children, they need a family. We had opportunity to have young doctors, less than 35 years old. Some of them don't have family, and they can sacrifice and do the effort of it. But we believe in this process to convince the government that that's the way, and convince the international organization. They can go and see our result. They can go and see what we are doing for the people, and they can recognize. And because the healthcare, we cannot measure only with the numbers. We have to measure. We have to evaluate it with the feeling of the people, with what the people think about the doctor is doing in the community. And it's not measured with one number, what you put in a paper, what is custom to do it. I think they have to find a way how to evaluate it inside the community, ask the people for their point of view of the work the doctors are doing inside the community, or what the change the people have been seeing inside the community since the work have been doing. I think the opinion of the people where you're working, the satisfaction of those people, that has high level of I don't know how to say it in English, but high level of value in the way how you evaluate healthcare. It's not only put a number in the paper and try to send it somewhere. I think they have to understand that. We are struggling to let them understand that, and they can provide to our doctors the same money that they are paying in some of those areas to others, to other doctors to work there. Then they can do a better job. They come from those areas. They understand the language for the people. They understand the values of the people, but they understand the beliefs of those people. They can do a better job with them.
Well, we've got just about a minute left. I think our viewers would be very interested in just an update on your work in Haiti.
When we had a wonderful work in Haiti, I reached to Haiti days after the earthquake, and then we decided to travel to Havana, Cuba after that to set a small office and and invite the doctor who were training with us in Latin American School of Medicine. Then we send them through Facebook, the technology, through emails, and contact them. In 1 week, we send like 2,600 emails to them and try to contact them, and we receive very fast in those 10 days, like 1,600 answers. The doctor who were training with us were willing to move. Some of them willing to leave the job in their country and go to Haiti. Some of them donate some different times to Haiti. Then we decided to choose from all those doctors 398 who were given the opportunity to give more time. Then we have...
Well, we're just about out of time, so how are the results now?
Now we have 398 doctors working there full-time from 28 different countries joining our brigade, but we are joined with the more than 300 Haitian doctors who are training in Cuba. Some of them is 5th year, 6th year, and some of them doing the residency. And we have a large brigade of 776 doctors from 29 different countries working there full-time in different parts of the country now. We're focusing in Port-au-Prince, working in the campamentos, and the people, more than 1 million people who has no house, who are living in the street. We work in those campamentos with 9,000 people living in each campamento. We have a small facility of 10 there, attending the people in the hospitals.
Well, it's exciting work. I'm very happy that there are people like yourself doing it. To our viewers, we'll see you next time on International Focus.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website,